Hello there, I'm Cristina González Castro, and in this video presentation I will address the most relevant aspects on exercising during the cancer journey. I will start with this image that many patients told me about. They feel like at a crossroads. As you know, the diagnosis raises many questions, and what to do in terms of physical activity is one of them. In fact, a literature review, this is a study of a lot of studies, published last year in 2020, points out that the most demanded information from women diagnosed with breast cancer is about the disease and its treatment, more specifically related to prognosis and side effects. However, they also requested information on how the cancer would affect the daily activities, including healthy lifestyles and exercise. Also about self-image and personal and family life, things like concerns about the risk of daughters or mothers of getting cancer, or how it would affect their sexual life, for instance. And finally, there is another category named Other, which included things such as financial concerns or not knowing who to ask certain information or where to find support. This piece of work included 18 studies published between 2010 and 2017, and it is quite global as the studies were done in Europe, Asia, America, and Australia. And although it was just on breast cancer patients, they seem to be questions that would concern most of the cancer patients, irrespective of the cancer site. What I want to point out is that if there is demand for information, this means that there is an interest, and interest is key for motivation, which is what moves us in life. So I will talk about cancer and exercise, and I will try to answer a few of those questions that you may have in this area. I will start stating that cancer is a term that we use to refer to more than 200 different diseases, so it is an umbrella term. And they have something in common, and that's that somewhere in the body, cells are replicating with no control. Why is this important? Well, because no two cases are the same. On the one hand, there are many types of cancer, and on the other, each patient has their own characteristics, comorbidities, physical condition, and so on. So in terms of physical activity, we will be able to talk about general recommendations and guidelines. However, exercise will have to be prescribed on an individual basis, taking into account the possibilities and needs of each patient. Lifestyle changes could prevent 4 in 10 cancers. This is 40% of all cancers, which is really striking. Of course, the good news is that lifestyle is something that we can control, and having adequate levels of physical activity is part of a healthy lifestyle. Despite this, I'm not going to refer to physical activity regarding prevention, but once the cancer diagnosis has been made. In this sense, in 2005, a groundbreaking study was published. It included almost 3,000 nurses with stage 1, 2, or 3 breast cancer between 1984 and 1998, and they were monitored until 2002. They found that those who exercised reduced mortality up to 50%. Since then, more studies have reached similar findings. But the reason why this was a revolutionary study is because they were no longer talking about the role of physical exercise in preventing cancer, but its effects on the prognosis of the disease. So what is the problem? Well, the majority of patients and survivors do not reach the minimum exercise recommendations. And why is this? Because there are barriers to exercise. There are many different barriers resulting from the cancer and its treatment, because of socioeconomic factors such as lack of resources or access to facilities or professionals and so on, and also individual barriers that would be different for each particular patient. Regarding those from cancer and its treatment, we're talking about side effects. And in this sense, we must bear in mind that cancer is not a very kind disease. Not that there are kind diseases, but usually when we are ill, we feel bad, and treatment makes us feel better. In cancer, on the other side, it is common that the treatment itself is what makes people feel bad. That's why I'm saying it's not a kind disease. So side effects will affect our exercising capacity and, of course, a quality of life. I want to make a special mention of cancer-related fatigue because it is probably the most important barrier to exercise and also the most common side effect. It is extremely disabling. However, it is not like common fatigue. Cancer-related fatigue does not go away with rest, so it is very easy to fall in a downward spiral in which fatigue is followed by inactivity, and if this persists in time, the body will decondition to a point in which it will be very difficult to keep active in any way. I understand that it can be counterintuitive to think that being active may improve fatigue, but I will put an example in which it might make more sense. Imagine this lady is going to do an experiment. She's going to lead a sedentary life for 30 days on a row. So she's going to do nothing at all. Sofa, bed, bed, sofa. How do you think she's going to be on day 30? Better or worse than in day 1? We must really understand that total rest is not indicated in cancer. The scientific evidence has shown that physical activity improves cancer-related fatigue, and the recommendation is to avoid inactivity and sedentarism during the whole cancer journey. In the prehabilitation phase, the aim is to get the patient to treatment in the best possible shape. During treatment, it is about minimizing physical deconditioning. And after treatment, we are talking about rehabilitation and regaining physical and emotional state. Look, this is a systematic review of 33 studies with more than 3,000 patients. It was published in 2018, and conclusions state that aerobic exercise improves or at least maintains physical fitness in patients undergoing chemotherapy treatment. Similarly, this systematic review was on patients undergoing radiotherapy treatment. It was published last year in 2020, and it included 26 studies with over 1,500 patients. Exercise improved fatigue, strength, exercise capacity, and quality of life. I also want to highlight that the lack of information or misinformation as partial or not very rigorous information often results in fear, and fear paralyzes us, always, in every aspect of life, and of course in cancer. It is important, though, that the information is there because it can help us overcome barriers to exercise. For instance, if we know that cancer-related fatigue is not going to improve by resting, or that being physically active as far as we can, within our possibilities, of course, is advisable even during treatment, we will be more likely to try to improve our lifestyles in these scenarios. Also, in addition, the scientific evidence has shown that physical exercise interventions added to conventional treatment, of course, are safe and effective, and they improve physical function, and they counter side effects, as well as reduce mortality in some types of cancer, and they also reduce the risk of secondary cancer and of other chronic diseases, and they improve emotional and psychosocial state. So physical exercise improves side effects, physical function, psychological state, and also protects against secondary cancers and other diseases, and it improves quality of life. There is no drug with such properties. There is no pharmacological intervention as cross-cutting as it can be applied to all patients. And best of all is that being active is something that we can control, because treatment is passive, but patients can actually play an active role in improving their lifestyle. In breast, colon, and prostate cancer, physical exercise reduces cancer recurrence, cancer mortality, and all-cause mortality, and those are the percentages. Okay, but what are the recommendations? The American College of Sports Medicine published exercise recommendations for cancer survivors back in 2010. I want to point out that In scientific literature, the term cancer survivor is used for anyone who had a cancer diagnosis until the end of life. So, as I was stating, the recommendations published in 2010 are very similar to those from the World Health Organization, and they included 150 minutes per week of aerobic exercise at moderate intensity, or 75 minutes if it was at vigorous intensity, and also 2 days a week of resistance training and flexibility. However, these were general recommendations, and the individual circumstances of each survivor should be taken into account. And the main message was that a little bit of physical activity was better than nothing. These recommendations were updated in 2019. For this update, they considered over 2,500 randomized controlled trials and several literature reviews and meta-analyses with around 1.4 million participants. In essence, the recommendations remain the same, with the underlying message of avoiding inactivity. And they also indicate, and this is important, that a sedentary lifestyle increases cancer risk. In this sense, I'm going to note that although the terms sedentary and inactive are sometimes used as equals, they do not refer to the same reality. A sedentary person is one who adopts a behavior that involves a very low metabolic expenditure, whereas an inactive person is one who does not meet the minimum physical activity recommendations. So, if someone is 8 hours per day sitting, this person will be a sedentary person, even if they exercise regularly. A sedentary behavior is associated with poorer health outcomes, irrespective of the physical activity levels. And according to the World Health Organization, it is the 4th leading factor for death in the world. I was explaining this in a talk, and a guy looked at me with dismay and said that he worked in an office, and of course he was sitting down for 8 hours per day. There are strategies that we can use. The recommendation is to break the sedentary behavior 2 or 3 times per hour, so all you need to do is to stand up and stretch. If you can walk for a couple of minutes, that would be great. Those of you with pets, you know that, let's say that your dog is lying and suddenly he gets up, stretches, and just when you think he's going for a stroll, he lies down again. He's breaking the sedentary behavior. For humans who have to sit for long periods, there are other strategies, such as placing the bin far away, so you have to stand up to go and throw things in it, taking phone calls on a standing position, and so on. Okay, so the World Health Organization also updated its physical activity recommendations last year in 2020. In essence, they remain the same, 150 to 300 minutes per week of aerobic exercise at moderate intensity, or 75 to 150 minutes if it's at vigorous intensity. For all subgroups except for children and adolescents, they should exercise at least 60 minutes per day. Also, muscle strengthening twice a week, and for older adults, balance and coordination exercises. These recommendations also advise limiting sedentary behavior. There is, however, a new perspective, as these guidelines have shifted from exercise training to active lifestyle. They are more public health orientated now, because an active lifestyle can be part of daily living, whereas exercise training had to be planned and structured. And also, and this is very interesting, for the first time, they include subgroups, and one of them is persons with chronic conditions. And then they mention cancer, hypertension, type 2 diabetes, and HIV. This is very significant, because if cancer is considered a chronic condition, then the necessary mechanisms will have to be established to cover the needs of those patients. And of course, they will go far beyond the main treatment. We are now talking about rehabilitation and control of the disease. The American College of Sports Medicine recommendations state that the oncology clinicians should follow a 3-step process: inform, recommend, refer. The medical team is not expected to give specific exercise prescriptions, but to assess whether the patient is physically active or not, and to encourage an active lifestyle, and refer to the appropriate professional if necessary. Also, and importantly, progress should be monitored during the cancer journey. So the goal is always to avoid inactivity. This is an exercise prescription model that I presented at the 2018 European Cancer Rehabilitation and Survivorship Symposium in Copenhagen. It is based on 3 simple steps: information, safe practice, and with the goal of creating a behavioral change to improve physical activity levels. Although I based my work on Nordic walking because of the great possibilities of this discipline in the cancer setting, it is of course valid for any type of exercise. So what is it that we can do? They say life is what happens to us while we are busy making other plans. And actually, there is often a mismatch between our own plans and what life is offering us. But realizing what is out of our reach, what we cannot control, is very helpful. At some point, we will encounter adversity, and all we can do is live with it. But we can control how to do this. We can improve how we experience life. We can improve our quality of life. This is very interesting because there's some research that shows that how we rate our quality of life is a strong and independent factor in survivorship in cancer patients. This is amazing. How we experience life affects survivorship. The next question, of course, would be how can I improve my quality of life? There are several factors that determine our quality of life. Each one of us is a universe made out of different worlds: our physical world, our bodies, our inner world, and a social world. And there are modifiable factors that we can act upon: physical activity, nutrition, and emotional health. We are what we do, we are what we eat, and we are what we think and feel. For those of you interested in this topic, and if by chance you know Spanish, I wrote a book during lockdown in 2020, El Camino de la Buena Vida, The Way to a Good Life. It is scientifically based, very easy to read, and I also provide practical strategies to improve our daily life. Okay, I have focused on physical activity, but it all comes down to taking responsibility of our own lives, whatever our circumstances are. I'm going to finish with some tips to improve physical activity levels. First of all, check with your medical team. They will be able to consider your particular case. Choose an activity that you like. Adherence, this is being regular with an activity, is a big problem in exercise prescription. So you will be more likely to engage in a regular practice if you choose an activity that you do like. As I am an expert in Nordic walking, I would encourage you to seek information on this discipline. It is basically adding a pair of special poles to our natural way of walking so that we engage the upper body in the forward movement. We push through the poles. One of the main advantages is that because we are spreading the effort between the upper and the lower body, perceived exertion is low. So although it is a whole body exercise, feeling of tiredness is low, and this is a huge advantage for special populations. I'm not going to dwell on this because you can find further information at my website, research4nw.com, and on my YouTube channel. Also, seeking company to exercise is a very good idea because it will help with motivation. And finally, set small goals. We usually live in the all or nothing, and we withhold ourselves from enjoying small achievements. Drop by drop, we will end up filling the glass. Remember the recommendations of the World Health Organization. Every movement counts. This is very true because a little is something, but less is nothing. And that is all. Thank you so much for listening. I really hope that you found it interesting. And those are my websites, fortreble.com and research4nw.com. And you can also visit my YouTube channel, For Treble, where you can find loads of different video presentations and talks. Thank you very much.